Let's do some fascial release work on the most powerful muscle of the body. Stay tuned. Hi, I'm Dr. Joe DeMarco, chiropractor and owner of OcraMed Health, and today we're doing fascial release work on the Gluteus Maximus. It's the largest, most powerful muscle in the body, and for some reason, it just gets overlooked when it comes to fascial release work. You know, I was searching videos on glute max release work on YouTube just recently, and for some reason, there's just not a lot of videos out there. You come across a ton of videos on glute medius, glute minimus, piriformis, quadratus femoris, all the smaller muscles, and for good reason, because when those muscles build up fascial adhesions, they do cause a lot of problems. But the gluteus maximus is by far the largest muscle. It covers all of those other muscles. And if you think about it, if you're building up fascial adhesions in the glute maximus, you're in for a lot of pain. Low back pain, hip pain, glute pain. This is a huge muscle, and it's going to wreak havoc on all sorts of areas of the body if it builds up adhesions. So we're going to do some fascial release work on it, but before we do, let's take a look at the anatomy. The glute maximus is the main extensor muscle of the hip. It also assists the hip in external rotation and abduction. Now, the glute max actually originates off of the ilium, the pelvic bone, but also it comes off of the sacrum and the coccyx, and it also originates off of the lumbar fascia, the sacrotuberous ligament, and the fascia of the glute medius. So there's quite a bit of origination points for the glute maximus. And then it inserts in two areas. It inserts into the IT band, which is a huge piece of fascia that's going down the lateral aspect of the leg. And then it also inserts into the gluteal tuberosity of the femur. So as you can see, this is a large, thick muscle. So you can only imagine that if that muscle, which like any other muscle is normally very elastic, if that starts building up adhesions, we're in a lot of trouble with the size and thickness of that muscle. And so what are we dealing with? If you just picture these bands as the muscle fibers of the glute maximus and the covering here that I put on them as the fascia, like any muscle of the body, that glute maximus, those muscle fibers should be stretching. We don't want any tugging and pulling going on. I mean, this is a muscle that attaches into the IT band. It attaches into the lumbar fascia, into the sacrum. So, of course, we want elasticity through this tissue, and that's the way it should be. But unfortunately, over time, micro traumas, major traumas, wear and tear, your body is always trying to help itself and repair itself, and it makes repairs by laying in like scar tissue or adhesion in there, and it starts binding up muscle fibers. The fascia starts binding up some of the tissue, and before you know it, you can end up with a lot of buildup of this cross fiber adhesion in here that's binding up muscle fibers. It doesn't allow them to move freely. It starts turning it from maybe, like if you could picture, from an elastic band into a leather band. You're losing elasticity. Now you go to move, that tissue is not stretching like it should. What's it start doing? If it isn't stretching, it's tugging. Where's the glute max going to tug? It's going to tug that IT band. That's going to cause a lot of problems. It's going to tug into the lower back. So you're going to have all sorts of symptoms that can develop from its fascial adhesions building up in the glute maximus. And like I said, this is a large muscle. You building up adhesions in this muscle, you're in a lot of trouble. So I want to go over with you today some home techniques you can use on how to break up these adhesions and get feeling great again and get back into the gym. All right, so let's get started with some fascial release work here. Couple things before we get started is that you should be aware of, and I've mentioned this on other videos. First off, make sure the tissue that we're doing the fascial release work on is warmed up. We never do fascial release work on cold tissue, so go for a walk, ride a bike, take a large foam roller and go over the muscle tissue with the roller. I'm not a big fan of large foam rollers as far as thinking that they actually break up fascial adhesions, but they're great for increasing blood flow. Personally, I think they're too large, too smooth. They don't get into the fascia, but they're great for a warm-up. And then so I'll use a large foam roller as my warm-up first before I move into my deep fascial release work with a massage ball. Second off, fascial adhesions, fascial release work is not fun. It hurts. It's not the most fun thing to do in the world, but it's important to do. And so you have to have a certain amount of pain tolerance. So if you're new at it, just go very light at first. Get used to the pressure in there. Go light. You may need to use something a little softer. Maybe you start with a tennis ball, move up to a lacrosse ball that's harder, but it's smoother. And eventually, you really want to get into using a Tai Chi ball from OcraMed Health because of the texture and the size. This gets deep into the fascia and it's going to break up those adhesions. I'm going to be using this today, but like I said, if you're new at it, start with something a little softer or a little smoother. So don't be surprised. You could have a black and blue. You could have some redness in the area that you work. It can be sore the next day. That's all part of fascial release work. So gauge your pressure. Okay, so let's get started. We have the massage ball. Only other thing we're going to need is a strap. What I'm going to do with the strap is I'm going to use that just to kind of help control the leg. We're going to get in there. I'm going to take this strap and I'm going to put it around my foot, but I'm also going to wrap it around once. So I want to be able to wrap it around because I want to have control of my leg, because I'm actually going to help use this strap to help control my leg as we do some of the fascial release work. Now, where's the ball going to go? As you saw from the anatomy where the glute maximus is, if you can actually get in there with your thumb and actually feel a knot in the glute maximus, start there. I mean, if there's already a knot that you can feel and it's giving you trouble, that's the first spot you're going to go with the ball. If not, there's a lot of tissue in here that you can work. The glute max is huge. Just stay off the bony areas. Don't put it near. Don't put it up against your sacrum, your femur, any of the bony anatomy. But there's plenty of tissue in there to get on with the glute maximus. But like I said, if you have a knot, start there. So I'm going to get on my back. I'm going to get that ball right on some of that glute max tissue, and I'm going to get it right under me, and to add pressure, I'm going to lean my body into the side where I have the ball. Once again, if you're new at this, don't put too much pressure, but obviously I do fascial release work all the time, so I'm actually going to not only get it under me, but I'm going to lean into it so that I make sure it's really getting deep into my glute max. So from this position, the other leg, you can have it straight, you can have it bent, whatever you want to do. I'm just going to put it out straight. I'm going to have my leg where the ball is under on that side. I'm going to hold on to this strap and I'm going to have it out straight like this. And then I'm going to use the strap to help me pull the knee in as far as I can pull it in. And I'm going to let that ball kind of dig in. And then once I get to the point of where I can't bring the knee in any further, I'm going to use the straps to help me externally rotate and internally rotate my hip. So I'm going to go back and forth 10 times. Really, by adding this motion, I'm really mashing that ball into my glute maximus. So I have it flexed up as far as I can, and I'm doing this external internal rotation movement for 10 times. Then I'm going to extend it back out. I'm going to come back again, pulling it in as tight as I can, and once again, I'm going to go 10 times with the external internal rotation. And I'm going to do that 3 times. So we're going to go through that 3 times where we pull up, and then 10 external internal rotation movements. Then I'm going to straighten it back out again, and this time I'm going to come up with the legs straight, and I'm going to go up as far as I can. And at this point, from this position, and I don't need to use the strap as much, but I'm going to once again externally and internally rotate my hip. And I'm going to do that 10 times. This just adds to like the mashing of the tissue. I'm actually already digging that ball in as I come up with it. And then by externally and internally rotating the hip, I'm really breaking that, digging that ball deep into that fascia, releasing the adhesions. So I'm going to go 3 times with this also. I'm going to bring it back down. I'm going to come up, let it push that ball into the glute max as far as it'll go. Externally, internally rotate the hip 10 times, so 3 times. So we get 3 times with the knee bent, we get 3 times with the leg straight. Then I'm going to come back down again, and this time I'm going to bring the leg out to the side, and at the same time I'm going to let the hip externally rotate, and I'm going to bring it all the way out like that as far as I can. And then from this position, once again, with as best as I can, I'm going to kind of wiggle that hip again internal and externally, and let that dig in again into the glute max. And I'm going to come back, and then I'm going to go out again. So we're going to do that 3 times, bring it out, wiggle that leg. You can't get from this position, you're not going to get a ton of movement, but I'm still going to try to externally and internally rotate the leg the best I can. And then I'm going to bring it back. And then finally, I'm just going to do a few movements where I'm just going to kind of bring the leg in a circle just like that. I'll go 3 times in one direction, and then I'm going to go back 3 times in another direction, the other direction. Okay, so after I complete all that, then I'm going to move the ball. So I'm going to go through all that while the ball's in the same spot. Then I'm going to move it. So how many spots am I going to hit? It's up to you as far as how tight the glute max feels to you, how many knots you find. I could move it maybe 2 or 3 times, or I may end up moving the ball around 5, 6, 7 times. But each time I move it, I'm going to go through that little routine and work on breaking up the adhesions. Of course, whatever I do on the right, I'm going to repeat it on the left to make sure that one side doesn't get jealous. All right, so give those fascia release techniques a try. They work awesome. You're going to notice, if you're consistent with it, because fascia release work doesn't happen overnight, but if you're consistent with it, you're going to notice a big change. If you're having trouble with squatting and you're having trouble with your depth, you're going to notice an increase in your range of motion on your squat. If you're having pain in your knee or your lower back or your hip, you're going to notice some relief. Of course, if things don't change, always consult your doctor or a good therapist. All right, exercise programs, mobility plans, our new SRI shock release instrument are all available on my website, www.OcraMedHealth.com. If you're enjoying these videos, please subscribe to my channel, OcraMed Health on YouTube. Questions about injuries or exercises, just leave a comment in the comment section below. I always get back to everyone who writes in. And don't forget, OcraMed Health is here to keep you fit forever.